Hi, folks. Thanks for joining us. We're just letting everyone come in from the waiting room, so we'll be getting started in just about 2 minutes. Thank you so much. All right, we're still admitting some folks, but we're going to go ahead and get started, at least with the administrative stuff here. Welcome, everyone, to today's presentation in our Trauma Responsive Lawyering series. We are incredibly grateful to the Office of Victim Services for giving us this platform and opportunity to engage with you all in this really important conversation about serving survivors of trauma as they engage with our systems. For those of you who are here for the first time, welcome. We're so glad to have you join us. For those who are returning, we really appreciate how much you're committing to engaging with us in this important topic. Next week, just as a reminder, there will be a break. We won't have a training, but we'll be starting up again the week thereafter with some really great programmings. I'm going to turn this over to Dr. Uju Berry to go over some administrative details. She spearheaded the group of us in presenting all of this, and so we're also extremely grateful to her. Thank you, Uju.
Thank you so much for that introduction, Johnny. So I'm just going to go over some logistic information. So again, if you've been here before, this is very familiar, but for new folks, I think it's always helpful to orient ourselves. If you can advance the slide, please. So this session is recorded. We do have a chat feature, which will be monitored by our wonderful Shani Ades, who's been the moderator for our previous sessions. If you have any questions or comments, please send a chat directly to her, and that will be the host. You're automatically muted upon entry. Please mute yourself throughout the entire seminar unless otherwise stated. If you're on the phone, the quickest way to do so is to use *6. At the end of the session, you'll be invited to fill out an evaluation. Please complete this as soon as you are able to do so. It will show up on the screen as the last slide as a QR code, and there'll be instructions on that slide in terms of how to complete the evaluation and use your smartphone to do so. If you wish to obtain CLE credit, there'll be a second evaluation to fill out, and that'll be sent via email. As mentioned before, all relevant course material are in the Google Drive. If you are trying to obtain continuing legal education credits, please see the registration link for information on CLE credits. An email with further information will be sent out again after this training for you to update yourself on how to do so. In order to get CLE credit, you must attend this entire training session with the name of the session written down and respond to both polls that will be happening throughout the period of this training. It'll happen at 2 time points. If you have any questions, please contact sadess@nylog.org. Today, we're very happy to have Kate Walsh today to talk to us about re-victimization. She's a wonderful addition to this program, and I know her personally, and I think you'll have a wonderful time hearing what she has to share. So Kate Walsh is a licensed clinical psychologist and associate professor of psychology and gender and women's study at the University of Wisconsin-Madison. She She also serves as the director of their newly established Sexual Violence Research Initiative, which takes an interdisciplinary lens to the study of prevention of sexual violence and treatment of associated outcomes for those exposed. Dr. Walsh earned her PhD in psychology at the University of Nebraska-Lincoln after completing an NIH-funded clinical internship in traumatic stress at the Medical University of South Carolina. She also completed a postdoctoral fellowship in substance use epidemiology at the Mailman School of Public Health at Columbia University. Her research focuses on both prevention of gender-based and sexual violence and the treatment of violence when it does occur. She has published more than 80 empirical articles and book chapters on these topics, and her work has been funded by the National Institute of Mental Health, the National Institute on Drug Abuse, and the Department of Justice. We're very happy to have Dr. Walsh here with us, and I'll turn it over to her.
Wonderful. Thank you so much for that introduction, Uju. I'm very excited to be here speaking with you all. I'm going to tell you a little bit about what I'm going to be covering today, and then I'll move on. So today I'm going to be talking a little bit about what re-victimization means, and I'll be describing some associated terms. I will also be describing who's most likely to experience re-victimization. Then I'll talk about some thinking or ideas around why re-victimization happens. I will also be describing how those who experience re-victimization might present when they're in a room with you. And then lastly, I'll be talking about some unique challenges that you may be facing in working with folks who have experienced re-victimization. So before I get started, I want to just make a couple of acknowledgements. So the first is that this can be really challenging material, and I know that you all are likely encountering this in your work with clients already. However, during this presentation, if there are things that you find triggering or the content is just too much, I get that. Feel free to step back for a minute and then rejoin us when you feel like you can. And I also want to really emphasize that self-care when doing this work is incredibly important. So I'll be talking about this again kind of towards the end of the talk, but vicarious trauma, so feeling traumatized by learning about other people's experiences, is a real thing. And I think that we all need to be aware of that and be thinking about ways to take care of ourselves. The second thing I'd like to acknowledge is that I'm going to be talking about research and to some extent clinical anecdotes in this talk. And I want to say up front that I know research is intended to be something that describes what things look like on average. And so there may be things that I'm talking about that don't really fit for you or for your clients, and that's okay. And I just want to put out there that that happens, and those are important to know about, and those are very valid experiences. And so we could think about talking about some of those during the question and answer portion of things. And then the last thing that I want to comment on before I get started, and I'll probably mention this a couple of times as I'm talking, is that I'm going to be describing a lot of characteristics of people who experience victimization. And in no way is this meant to say that folks are responsible for their own victimization experiences. It is always the responsibility of the perpetrator, and never the responsibility of the person who experiences the violence. So I know you all know that, but I'm just putting it out there so you know that this is where I'm coming from. All right, so I'm going to take about 2 minutes here to present a case example. I want you all to take a moment to read through this, and then I'm going to be referring to this case example as I start to present. Sure, I'm happy to read this out loud. So Antonia is a 37-year-old cisgender bisexual Latinx woman. She's a homeless veteran who's been trying to get clean from alcohol for over a decade. She lost custody of her children to an abusive ex 5 years prior and has periods of sobriety where she cooperates with her legal team, attempts to gain stability, and tries to gain custody of her children back. However, she's lapsed at critical moments. So for example, before important court appearances or at the tail end of a long period of sobriety. Her trauma history is long and complicated. Her mother died when she was a child. Her father passed away from alcoholism when she was 4, and she was sent to live with a distant uncle. This uncle began sexually abusing her around age 5. The abuse was discovered by a medical provider. The uncle was charged, and she entered the foster care system. Over the course of the next roughly 10 years, she had about 9 different placements before aging out of the system. She was sexually and physically abused in 2 of her foster care placements, and her first boyfriend at age 13 raped her. She entered the military when she aged out of the foster care system. She started drinking and using inhalants when she was 10, but was able to get clean for a period of time while in the military. She also experienced a rape by a fellow soldier, and upon discharge tried to get clean again. She married an abusive partner, although he wasn't abusive when she married him, and had 2 children, but lost them 5 years ago in a custody battle, and has seen them a total of 3 times since then, and they were all supervised visits. She's dated on and off, usually women, but has had occasional one-night stands with men as well. She's just been back through detox and wants to regain custody of her kids. So this is a pretty intense trauma history, but not completely outside the realm of what I certainly see in my clinical practice, and I'm sure some of this may ring true for what you might see in your legal practice. So I want to start off by talking a little bit about what re-victimization is, and then describing some related terms. These related terms include repeat victimization, poly-victimization, and complex trauma. So like the vignette that we just read suggested, re-victimization is essentially the idea that folks who are exposed to early life abuse, specifically physical or sexual abuse, may be at risk for having this happen again at a later point. Most often, this definition has been restricted to looking at someone who's exposed to physical or sexual abuse in childhood, and then they have it happen again in adulthood. And so a recent study that collated a lot of results of different studies looking at various types of samples, so community samples, incarcerated samples, clinical samples, saw that for every 2 child sexual abuse victims, 1 of them was likely to report sexual assault in adulthood as well. And so 1 out of every 2 child sexual abuse victims will go on to experience re-victimization. One of the problems with this kind of narrow definition is that it really focuses on this childhood and this adulthood period, and it doesn't account for nuance and additional experiences of assault that may be happening within those periods. This is particularly important because we know that some of the highest risk periods of life for experiencing violence are between the ages of 12 and 24. And so people may experience multiple episodes of violence and victimization in that adolescent period, and that's not really captured in any way with this definition. So more recently, folks have been moving towards defining re-victimization in terms of repeat victimization. And so this takes away that kind of developmental period necessity and looks at victimization that happens kind of across the life course and accounts for victimization that might be occurring within developmental periods as well. And so, of course, when we look at it in this way, we see a higher prevalence when we're not restricting it to those particular developmental periods. And so I'm going to show a graph here on the right. And I will say that these data are from nationally representative samples. And in this study, we were focusing on very narrowly defined rape experiences. So everyone who reported lifetime victimization here was reporting on penetration that occurred due to the use of force or to alcohol or drugs. And I say this because we would see much higher estimates if we broaden this to include other kinds of sexual victimization or other kinds of victimization like physical abuse, et cetera. So in this sample, we were fortunate that we had actually 3 separate samples. So we had a sample of adolescent girls. They are represented in the left bar, college women who are in the middle bar, and then adult community women are in the right bar. And so the blue lines show the percentage of individuals in each of these samples who experienced any rape. So in adolescent girls, about 11% reported that they had been exposed to any rape during their lifetime. In college women, about 12% had experienced any rape, and then in community women, about 20% had experienced any rape. However, the red bar shows the percentage of those who'd experienced any rape who reported 2 or more lifetime assaults. And so you can see that for each of these samples, 50% or more had been re-victimized or had experienced repeat victimization already. And this means that they'd experienced at least 2 assaults. They could have experienced more than that. And so what was particularly striking to me in doing this work was that adolescents, who are on average 14 and a half years old in this sample, already more than half of them had experienced 2 or more assaults. And this is striking for me as a clinician because a lot of times, we don't see people until many years after their victimization experiences. And so a lot of our prevention work has focused more on kind of like that early adulthood period. And this really struck me as saying we have to be starting prevention work much sooner. But I think where it may be really relevant for you is thinking about just how complicated and complex folks' trauma histories might be. And so again, I'll bring this back to the point that, this is just focusing on rape experiences. And if we broaden this to look at other kinds of victimization, these prevalences would look much, much higher. The other piece that I'll say is that this is focused on nationally representative samples, right? So this is just people in the community. And if we look at folks who are incarcerated or folks who are treatment seeking, we see significantly elevated rates of violence in those samples too. So these are likely underestimates for the populations that you are seeing. So I want to mention 2 other terms that I think you all have been exposed to and that fit with this idea of re-victimization. And so one is poly-victimization. This is essentially the idea that people can be concurrently exposed to different kinds of adversity. So it reflects exposure to violence, abuse, and other types of crime. And one of the early definitions was really about co-occurring experiences of sexual abuse, physical abuse, bullying, and exposure to family violence. More recently, I think the definition has been kind of expanded to reflect that there can be lots of things that kind of fall under this broad umbrella of poly-victimization. And nationally representative data suggests that nearly 1 in 5 youth report some form of poly-victimization, meaning they have 2 or more of these kinds of violent abuse or crime experiences, which is unsurprising. However, among youth that report any victimization, about 49% of children and youth suffered 2 or more in the past year alone. And so I think that really highlights just how pervasive and prevalent these kinds of experiences are, particularly during some of these higher risk developmental periods. A term that's very much related to poly-victimization but has some different connotations, but that you've likely also heard about, is called complex trauma. And so this term describes exposure to multiple traumatic events, often things that are of an invasive, interpersonal, chronic, or severe nature. So poly-victimization doesn't necessarily specify the chronicity, although some of those events certainly may be chronic, particularly like the abuse that's happening. But complex trauma often is focusing on invasive, interpersonal, and very severe and chronic kinds of trauma exposure. So some examples would be chronic and severe child abuse or chronic and severe domestic violence. Complex trauma, though, gets a little bit tricky because it not only refers to the trauma exposure, so the events that actually happened, but it can also describe the wide-ranging long-term impacts of exposure. And so it might be the symptoms that a person experiences following exposure to all of these types of events as well. And so that's where things get a little bit tricky with that term. However, I think one thing to note about all of the topics that I've discussed so far, so re-victimization, repeat victimization, poly-victimization, and complex trauma, all of these terms all have like a repeat or cumulative trauma element to them. And so I think that what I would hope that you take away from this is that there are a lot of different ways that people experience trauma. Traumas often co-occur together, and our clients can have really complex trauma histories. So for just a moment, I want to come back to the vignette that I read earlier and just comment on different ways that you might have seen re-victimization, repeat victimization, poly-victimization, and complex trauma kind of coming out And so I'm just gonna move myself back up to that one really quickly. So there are a few things in here from a re-victimization standpoint that stand out, right? So she was first abused around age 5 by an uncle, and then she was sexually and physically abused in 2 of her foster care placements. Her first boyfriend at age 13 raped her. She was also raped again in the military, and then she experienced violence in the context of this abusive partner who she married. And so if we were just looking at re-victimization as child to adult, we would really be missing all those victimization experiences that happened to her in her foster care placement and when she was 13 and possibly even early in her military career. And so you can see elements of both re-victimization and repeat victimization kind of happening here. But then there are also other types of experiences that she had. So her parents both died when she was in childhood. So that certainly is a stressor. Being in the foster care system is certainly a stressor. And then you can see a lot of the possible outcomes, so things we're going to be talking about later on today. So substance use, there's also been a negative impact on her interpersonal relationships, so she's not able to see her children. And so we're going to be coming back to this, but I just wanted to highlight some of the ways that re-victimization can be seen in this particular case example. Okay. So moving on, in the last slide that I showed you, so this slide on polyvictimization and complex trauma, a lot of the focus here is on victimization experiences that occur early in childhood. And while we know that having earlier exposure during developmental periods where maybe your brain is still developing can have really significant impacts, I don't want anyone to think that that these kinds of co-occurring traumas can't happen in adulthood as well. And so I just want to present some data, again, from a nationally representative sample, but just looking at gender-based violence among women. And so here, gender-based violence is defined as physical and sexual violence against women, as well as stalking. And in the US, we see that about 1 in 4 women will have experienced some kind of gender-based violence, but these are pretty narrowly defined definitions. So these are very severe forms of violence. In terms of physical violence, it's often, getting physically injured, being severely burned, etc. Sexual violence is focusing on rape in particular, and then stalking is our criteria were pretty stringent for this. So I'm putting that out there so you know that if we relax the criteria, we would see even higher prevalence. But essentially what we see is, although it's small, a significant portion of people report at least 2 or sometimes all 3 forms of gender-based violence. And this is among adult women. And so I don't want anyone to come away thinking that these things only happen in childhood. We see them happening kind of across the life course. All right, so I'm going to start talking just a little bit about who is most likely to experience both victimization and re-victimization, just to give a sense of kind of who is disproportionately impacted by these experiences. So on the last slide, I talked a bit about gender-based violence, and that slide was really focused a lot on women. And we know that cisgender women are at elevated risk for both initial victimization and for re-victimization compared to cisgender men. However, individuals who identify as non-binary, transgender, or gender diverse or expansive are at even elevated risk compared to cisgender men, and in some cases to cisgender women. We also see that sexuality is an important risk factor. So individuals who identify anywhere along the spectrum from lesbian, gay, bisexual, et cetera, are at elevated risk for both initial victimization and re-victimization. And we see in particular that gay men and bisexual men and women are at significantly elevated risk here. Race is also another factor that we've seen being related to risk for victimization. And so in one study, actually these were multiple studies of Black women who had child sexual abuse experiences, we saw that between 30 and 60, roughly 60% of women went on to experience adult sexual assault. And so there is a significant relationship there. You may be wondering why that range is so broad. And so I will just say that the broadness of that range from 30 to 60 really reflects the different ways that we assess victimization experiences. And I'm going to talk about this a little bit later in the presentation, but this may be helpful just for folks to know. Many people will report behaviorally specific activities that meet criteria for rape or sexual assault, but they don't label themselves as rape or sexual assault victims. And so studies also use different methodology like this. Some studies will ask people like, have you ever been raped or sexually assaulted? And other studies actually ask very behaviorally specific questions about, did this happen when you were too incapacitated by drugs or alcohol to resist or consent? And so give very behaviorally specific descriptions there. And so when we see these discrepancies, oftentimes we get higher estimates if we ask the behaviorally specific questions than if we ask the have you ever been raped or sexually assaulted questions. Side note. Okay, so then the other thing that I'll mention is that Indigenous and multiracial women are at elevated risk for experiencing sexual violence and partner violence relative to folks from other racial and ethnic backgrounds in general. And so we see that about 1 in 2 Indigenous or multiracial women will experience some kind of sexual violence, similar estimates for partner violence. And in some cases, we see elevated rates for both of those groupings. And what I will say is that we don't have great data on re-victimization in these groups. And so I think that that's an area where we need to do better scientific work. But my hypothesis is that they also have elevated rates of re-victimization. And this partly comes from qualitative research where we ask people to kind of describe their experiences in an interview and we get sort of ethnographic data from them. We see folks from Indigenous and multiracial backgrounds reporting repeated exposure to different kinds of traumatic experiences. And then, there are multiple factors. I'm mentioning just a few, but I think it's important to note that economic insecurity can be a significant risk factor, both for initial and for ongoing victimization. Poverty or impoverished circumstances can put people at risk for a variety of different reasons. It may be more difficult to put safety measures in place. You might be exposed to more people who could potentially perpetrate against you, et cetera. And so I think it's really important to kind of keep that social and contextual variable in mind when talking about this. The last thing that I'll note that I'm guessing likely comes up a good amount in your practices is that we really lack good data on victimization and re-victimization among undocumented persons. Again, my hypothesis here would be that it's pretty significant and quite elevated in these groups. And so one thing to note is that all of the characteristics that I've described here are ways in which our society kind of creates systems of oppression. And so these are all groups that are oppressed in some ways in our society. And I think it's really important to acknowledge that and the role that that oppression plays in risk for victimization kind of going forward. Okay, so I'm going to pause here for a moment and ask you all to just think a bit about the challenges that you have encountered in working with people who might have these kinds of complex trauma histories, including re-victimization. And so at this point, you're welcome to kind of type into the chat if you'd like anything that you've encountered. And then Shawnee will take just a couple minutes and read some of those back out to us.
So I'll give folks a couple of seconds to be able to type in. So one thing that that people are noting is a lack of trust in systems for people that have suffered victimization, especially re-victimization in the past, in particular when systems haven't responded appropriately to them. And kind of in a similar way, resistance to even sharing their trauma and fully opening up to provide their advocate with all of the information.
I will, yeah.
People that, just a reminder for everyone to mute themselves if you haven't. People that, perhaps people having trouble remembering important details, but by that also perhaps conflating experiences and not being able to very clearly divide out what happened when and by whom. Emotional outbursts and kind of misdirected anger, inability to follow through with some of the things that are really important in terms of being able to proceed with what they've identified as their goals. So for your example, in the case, inability to kind of proceed with that goal of achieving custody or even visitation. And one person wrote in with a bit of a question as well, which is, you know, we know and understand that many people may have this inability to trust the system or to trust us because of their past. And so how do we explain the process and the options without kind of, with minimizing the harm? Because we have to be honest with somebody, but how do we minimize that harm while we do that?
Yeah, fantastic comments. I think I will definitely touch on a few of these as I progress, but I think many of these are things we should return to in the question and answer portion as well. So I'm going to keep going with this, but thank you so much for sharing. It sounds like you all are thinking about this in very similar ways to kind of what I see as well. So I'm going to present two different models that kind of help us to understand why re-victimization might happen. There are many, many, many models out there. The two I'm going to present, one is really focused on kind of social structures and thinking about individuals in the context of both society as well as communities and their kind of interpersonal relationships. And so this really speaks to the point about kind of systems and like trust in systems. So this will be the first that I talk about. And then the other one that I'm going to speak about is more thinking about on an individual level, how do these things happen? So this model is really focused on thinking about individuals in the context of kind of broader systems. And so at the very individual level, this model might suggest that individuals have characteristics that we know are associated with risk for experiencing violence, right? And so we talked about a few of those, things like race and ethnicity, gender, sexual orientation. I'm also going to be speaking about a few of these later on in the presentation, but we know that folks who have a history of mental health conditions, those who have experienced adverse childhood events, and those who've experienced or have difficulties with alcohol and drugs are at higher risk for experiencing violence. So those are kind of some of the individual level characteristics. At the next level, or like the interpersonal or relationship kind of level, we see a number of different influences being important to think about here. So a lot of times the violence and the victimization that we are responding to is happening in the context of like families or intimate relationships, so dating and sexual kinds of relationships. And so it's really important to think about like what that means for folks. And a lot of times when I talk to people who don't have as much knowledge and awareness of the situation, like they might ask questions about like, well, why doesn't this person leave? And I think it's really important for us to think about the complex interplay between how this violence is happening or how these victimizations are happening and kind of like what that means for their life and their relationships. So the second piece I'll bring up here is that social support can be a really, really important factor for folks. I will be talking about this later on in the presentation as well, but you know, being able to tell someone about what happened to you and having them respond in a way that's accepting of that is not something that everyone experiences when they disclose. And so having folks that you can rely on can be a really important source of strength and can help to prevent additional victimizations from happening. And that's not what all of our clients might have in their lives. At the next level, so more of like the community level, and this might look a lot of different ways. This might be like, you know, a social community, or it might be like a school-based kind of community if you're thinking about kids, et cetera. Attitudes and resources that are made available for sexual assault, sexual health, and kind of like healthy relationships in general, I think are really important. So if people perceive that like, hey, in my community, you know, often victims are blamed for what happened to them, like that really impacts whether or not folks are willing to come forward and tell their story. And if they're not willing to come forward and tell their story, it kind of puts them at risk for being re-victimized because they're sort of in this position where, you know, the perpetrator knows like this person's never going to come forward about this, like they've had a bad experience and they're just not going to do it again. And so I think it's really important to think about like community as a whole, what are the attitudes and what are the resources available? And then at the broadest level, I think this probably speaks most to like the systems that folks were talking about just a minute ago. But this idea that, you know, we have these economic and social policies that we put in place. And, you know, oftentimes we don't have enough in the way of resources for healthy relationships and for preventing violence and for responding to violence. There's also generally kind of a broad social acceptance of violence against women and non-cisgender male populations. And so general kind of beliefs that folks who experience violence are at fault for what happened to them in some way. And then lastly, as someone mentioned from the chat comments, this idea of how like police and the judicial system sort of respond to reports of violence can substantially influence how someone proceeds when they experience a future kind of assault, right? So if you have a bad experience with the police or the judicial system, and many people do, that can really influence like how trusting or willing you are to engage with the system in the future. And so I think it's really important to think about how all of these different sort of levels can shape how an individual might feel about their own experience and how willing they are to reach out for assistance when assaults do happen. So the second model I want to talk about really focuses at an individual level on what might be happening when someone experiences re-victimization. And so whenever I tell people who don't know much about the area, like what I do, a lot of people respond to me with like, you study re-victimization, but like, wouldn't people who've had an assault be better at preventing a second one from happening because they know the risk factors, and so they'd be more likely to pick up on something bad about to happen? And in fact, that's not what we see at all. The data suggests that folks who've experienced violence in their lives actually take longer to identify risk for additional assault. And there are lots of other reasons why someone who's had an early assault may not be able to kind of either detect risk or to respond to that risk when it happens in the future. And so I'm going to talk just a little bit about what some of those different pathways might look like. Again, I want to pause right here and say that even though I'm talking about kind of like an individual model of like how re-victimization happens, this is in no way intending to imply that individuals who experience re-victimization are at fault for what happens. This is more to help us sort of understand like, how is this happening in the real world? Perpetrators are always at fault. And I think a lot of what I'm going to be talking about is really showing how perpetrators are kind of picking up on risk. The whole goal of this research is really to think about ways that we can buttress against risk for re-victimization among folks. And so thinking about how can we do harm reduction approaches or harm reduction strategies in these groups, not at all trying to think about them as being responsible for preventing their own assaults. So this model that I'm going to be talking about is called the Read, React, Respond model, and it was originally designed to explain risk for re-victimization among girls who'd experienced early childhood sexual abuse. And so there are three different parts of this model. The read part of the model is both about perceiving, hence the little eye diagram here, and about evaluating, so more of the scales, kind of like weighing things diagram here. And so the idea with perceiving is really being able to pick up on risk cues in our environment. And so this can be influenced by a number of different things. First, we know that most assaults happen in the context of relationships, right? And so oftentimes people are not expecting to be assaulted in the context of their relationships, particularly if it's like an acquaintance or a friend or someone, and this is the first time it's happening. And so I think that kind of your expectations for the situation can definitely set up like how prepared you are to be on guard or looking out for risk. But then there are some interpersonal characteristics that can definitely make risk recognition more difficult, and I should say individual characteristics as well. So one thing is looking at symptoms that folks might experience as a result of an early victimization. So I'm going to be talking in a little bit more detail in just a minute about PTSD in particular, but one of the symptoms that we see for PTSD is emotional numbing. And so this in like a room with you, this might look like somebody just not really showing a lot of affect. They might seem just kind of very blunted. They don't really seem to react to things positively or negatively. They just sort of maybe look a little bit out of it. Taking that a step further, there's a concept of dissociation, and dissociation reflects being more kind of disconnected from current reality. So disconnected from one's thoughts, one's feelings, and one's surroundings. And so in a room with you, this might look like somebody who just really seems like they're kind of off in their own world. They're not really paying attention to kind of like what's happening in their environment. And so certainly folks who are maybe not not as attuned to the environment may take a little longer to pick up on risk when it's happening, right? And perpetrators pick up on when folks are maybe not as attuned to the environment. So that is one way that perpetrators target people. Another way is through substance use. So substance use can have the same kinds of impacts as dissociation or as numbing, where it makes people kind of less reactive or less attentive to like what's happening in the environment. And so again, these are not, my strategy here wouldn't be to tell people don't use substances or, well, you just gotta fix your dissociation symptoms. It would be more about thinking about how those symptoms or those behaviors might increase risk, and are there things that we can put in place to help people be safer in situations where they might be with folks who are likely to victimize them. So the other piece to think about here as well is that it's not just about perceiving risk, but it's also about weighing risk in relation to like individuals' goals or their needs in that situation. And so I often think a lot about clients who will be telling me about assaults that happen where it's on a job or something along those lines. The person is in a position of power or authority over the person I'm treating. And it's really difficult, especially, and this might be where poverty comes into play, especially if that's a job that you desperately need to keep. And so I think thinking about you know, perceiving risks in those kinds of situations can be really challenging because you want to believe with all your heart that it's not happening. And so it takes longer, I think, for folks to kind of come around to being like, oh, you know, and recognizing that for what it is in many cases. So at the next step in this model, the react step, this is a lot more about the biological response to threat. And so I know in the last session, you all talked a bit about how the brain and how one's biology is impacted by exposure to stress. And that comes up here as well. So our stress response system, the hypothalamic pituitary adrenal axis, or HPA axis, is designed so that when we are exposed to a stressor, we release cortisol, right? And that cortisol and that adrenaline can then mobilize like a fight or flight kind of response. And what we see with folks who've experienced kind of chronic trauma or chronic stressors like these is that they don't have that same kind of stress response. So instead of having that heightened cortisol, we see more of this kind of blunted response. And we think that that's happening because people have been exposed to chronic stressors like this over time, and high levels of cortisol delivered to the brain kind of chronically can be really, really damaging. And so our brain and our body have these ways of kind of like shutting down that response so that the brain doesn't end up being damaged. And so then we end up seeing these kind of lower levels of circulating cortisol. But what that means from the perspective of how that's experienced by someone is that they may not be as reactive. Their biology is not as reactive. Their kind of warning system about like, hey, something's not right here isn't working in the same way because of the repeated exposure to trauma. And so then in the very last phase, kind of the respond phase, this is really where, you know, the fight or flight response kicks in. And I'm going to go ahead and add one more here. Fight, flight, or freeze. And so a lot of folks have probably seen like, you know, the pictures of like a deer in headlights or something along those lines where, you know, we see animals having this response where when they are really frightened, sometimes it's not about fighting or about fleeing, it's just freezing in that moment. And humans do the same thing. And so the response to a trauma can really vary quite widely at a very biological level. We call that freeze response tonic immobility. And so if a survivor is telling you, you know, I have so much guilt and shame because I didn't do anything in the moment, I felt like I couldn't fight back. This gives you the tools to be able to say to them, actually, that's a response that people have, and that's not your fault. This is sometimes how folks respond to really stressful situations. The other piece I want to mention here about responding is a lot of responding is very contextually based, right? So figuring out what you're going to do and how effective what you're going to do will be really depends on the situation that you're in. And so one of the things we've been kind of modeling from a scientific perspective is the idea that, you know, if you detect risk early enough in a situation, your options for escaping or avoiding assault in that situation might be a lot broader than if you're detecting risk later in the situation, like perhaps, for example, after someone has already isolated you from other people, then you can't rely on other people to help you get out of a situation or something along those lines. So I just want to point out that, the response is both biological and very contextual and situational. And so this makes it really challenging, I think, in terms of helping people do harm reduction stuff, because we can't predict what like a future situation is necessarily going to look like in all situations. So I'm just putting that out there so we all sort of have an understanding of, like, on an individual level, how this might happen. I want to pause for a moment because I know I've just described kind of two complex models here, and just give people a little bit of a breather for a second, and then I will move on to talking about a few other things. Okay, so now I want to move into talking about how re-victimization might impact survivors. One of the first areas I want to talk about is in mental health. And so before I even get started, one thing that I think is really helpful to know is that some of the outcomes of violence and victimization, we also see being risk factors for additional violence and victimization. So you've kind of heard me using this language already, talking about mental health symptoms potentially being a risk factor. So I want to note that these are both outcomes and risk factors for additional victimization. And we think that they're kind of happening cyclically. So each time you're victimized, your mental health symptoms might get worse. And then that in turn might make you even more vulnerable to having another assault happen, because a perpetrator might pick up on increased vulnerability. So I just want to present a little bit of data, just coming back to the adolescent college women and adult community women samples. Before I do, I just want to briefly mention PTSD. So PTSD is a disorder that's characterized by a lot of different kinds of symptoms that happen in the aftermath of a traumatic experience. I mentioned a few earlier, so kind of numbing symptoms. The other symptoms that we often see are re-experiencing symptoms. So somebody might be having intrusive recollections about what happened. They might have nightmares. When things remind them of what happened, they might have a very strong physiological reaction. We also see avoidance. So people will go out of their way to avoid people, places, and things that remind them of what happened so that they don't have that intense physiological reaction. We also see affective symptoms. So I talked about numbing, and that's very common. There's also often a lot of like anger, affective lability. And so I think a few people mentioned in the comments earlier, kind of, having folks who seem to be like really emotional in different ways. We see that for sure. And so I just want to put that out there, that there are lots of different kinds of symptoms, and they can all exist within the same person. So you can see like numbing symptoms at one point, and then you might see like intense re-experiencing symptoms, or you might see a lot of this like affective lability, anger, etc. So just for context, before I present the data from the adolescent college and community samples, I just want to note that among trauma-exposed samples in the general population, so this is including all kinds of trauma exposure, motor vehicle accidents, exposure to like natural disasters, only around 8% of the population will develop PTSD. However, in our samples, we see that for adolescent girls, the singly victimized adolescents are in the blue bars, the re-victimized adolescents are in the red bars. We see nearly 30% of adolescent girls report lifetime PTSD symptoms, and 20% report past month PTSD symptoms. Sorry, past 6 months. Same thing is true for college women. And in fact, the prevalence estimates here for lifetime and past month are significantly higher, which surprised me because I think we often think about college as a time when folks would be able to go on and might be a little bit more high functioning, which doesn't mean that they're not high functioning, but these symptoms relative to the other groups surprised me. And then we see the same pattern in general among adult community women as well, with slightly lower prevalence relative to the college women, but still significantly higher than the 8% for any trauma, and substantially higher for those who experience re-victimization. So I'm going to just very briefly show a model of how, in addition to this being an outcome, it can also be kind of a mediator or a risk factor for additional victimization. So here the idea would be that someone experiences sexual violence, you could sub in partner violence, any other kind of violence. They might develop PTSD and maybe dissociation symptoms like I was talking about before. And that puts them at risk for re-victimization by possibly signaling to perpetrators some kind of vulnerability, or perpetrators picking up on some kind of vulnerability, I should say.
I'm going to quickly interrupt here to launch our first poll. For any attorney who is here requesting continuing legal education credit, there's a poll currently on your screen. It's going to be up for just 1 minute, so please respond. The poll is a simple yes or no question. That's all. It will disappear as soon as you answer it. So please take a moment to do so. Thank you.
Okay, I'm going to keep talking. Another area where we might see re-victimization impacting survivors is in behaviors. And so I think a few people mentioned earlier things like substance use, perhaps risky sex, including things like trading sex, etc., and self-harm behaviors. And so here is, I'm not going to show you all of the data from the adolescents, college women, and adult community women. This is just one snapshot from the adult community women. But here we looked at non-victims, singly victimized women, and re-victimized women, who are again in the red bars, single victims in the blue bars. And you can see elevated risk for substance use problems across all of these different domains. So alcohol, marijuana, other illicit drugs, so this would include things like heroin, cocaine, PCP, etc., and then non-medical prescription drug use. And so this might be OxyContin and opiates, but it could also include like tranquilizers and other sorts of things. And it really means that someone is using, they're either using a prescription that they've been prescribed kind of not as prescribed, or they are obtaining medication that they actually haven't been prescribed and using it. And so elevated risk for substance use. And just like with mental health symptoms, substance use can also increase the likelihood of re-victimization. And so one idea here might be that someone uses substances to cope with negative affect or to self-medicate, and then this may be something that perpetrators pick up on as a vulnerability characteristic, like, oh, this person, I could assault this person and they're not going to like tell anybody because they were using drugs or something along those lines. And so then the last way that re-victimization can impact survivors kind of like formally is really in this like interpersonal sort of trust and intimacy domain. And I think that this might look very different sort of in a room with you than it would with like an intimate partner. So I'm going to talk about in a room with you in just a minute, but just from like an intimate partner perspective, one of the things we see is that folks who have these kind of extensive histories may be really craving kind of intimacy with people, but they don't feel like they can trust the people who they might want to have this like intimate relationship with. And so instead of having like deep emotional intimacy with someone, so like disclosing your history, really being like in a connected, ongoing, emotionally intimate relationship, they may instead seek out more short-term kind of intimacy. And so sex can be, very positive, and it can provide them with those short-term feelings of intimacy. But because they don't want to engage in kind of these longer-term relationships, they may move from partner to partner. And so in the moment, it helps to reduce negative affect. However, moving from partner to partner may increase the likelihood of coming into contact with a sexually aggressive person. And I just wanted to say that, this one model of sex to reduce negative affect is one way things could work. There could also be other things happening here too, where maybe the person is engaging in sex for survival, prostitution, etc. And these latter two parts of the path would still apply because you're still coming into contact with a greater number of people, some of whom could be aggressive. So now I want to talk just briefly about how a person might present in a room with you. And so what kinds of cognitions, emotions, behaviors, and interpersonal kinds of things might you be seeing? So in terms of thoughts, a very common thought that folks might have is kind of the idea that being assaulted or being victimized in some way really is tainting them, and they feel dirty and kind of think of themselves as like never being able to recover from this. And that's a powerful, powerful emotion, and something that really drives shame and maybe some of the behaviors that people were talking about before, like a lack of trust in disclosing or a resistance to disclosing. So I think it's really important to know that these kinds of thoughts and these emotions are not uncommon in folks who experience chronic trauma. I mentioned earlier that labeling and acknowledgement are thoughts that might be a little bit baffling for you. I'm going to talk about this in a little bit more detail on a future slide, but I just want to put out there that when you're talking with someone and they are describing experiences to you where you're like, wait, that's rape or that's sexual assault, but they don't label it that way, you might be confused about why they don't label it that way. And I just want to put out there that that's actually quite common. So I mentioned that earlier. You know, when we ask people, have you been raped or sexually assaulted? Many people will say no, but they'll still tell us about events that actually really meet those criteria. So it just might be helpful to know that that's a very common thing if you're experiencing that. From an emotional perspective, I think people were talking about folks having kind of emotional outbursts. And so that would be more along the lines of like these emotion dysregulation features that we might see. I see people who, you know, in my own practice kind of vacillate from this sort of emotional numbing profile where they don't seem sad all the time. They just seem sort of like blunted, but they're also not able to feel happiness around events that should feel really happy for them. And so I had a patient once who told me that the way she knew she needed to seek therapy was because her son was having a birthday party, and, you know, she had like done all the things and gone all out. And she was like, I know I should feel really happy about this, and this should be just like such an awesome thing for me. And yeah, I like can't feel anything. And so her whole motivation for coming into therapy was like, she wanted to be able to feel again, even if that meant feeling some of the really negative, bad emotions. In addition to this emotion dysregulation, I think feelings of shame, guilt, and self-blame are just so common. And I think society really reinforces these feelings. And so that's so important for us to pay attention to when we are interviewing or trying to elicit accounts from folks about what happened to them. And then lastly, I just want to mention that we see sexualized behaviors and substance use, things which may probably from your perspective be very difficult to defend or to you know, help to make sense of, especially if you're thinking about putting someone on the stand to testify around something and you're worried about, you know, the other side potentially attacking their character and that sort of thing. Sexualized behaviors and substance use are common things that we see in response to a traumatic experience. And so I just want to put that out there, and that, you know, if you can meet that with like non-judgmental kinds of questions, that can really go a long way towards building trust. And then lastly, avoidance, which I'm sure you see in various different ways, like maybe not coming to appointments or not showing up for things that they need to be showing up for, but also maybe avoiding talking to you about certain parts of their experience. So a few different ways that these thoughts, emotions, and behaviors can kind of all interact is by perhaps diminishing the person's interpersonal effectiveness. So having these thoughts about oneself as being dirty or, you know, tainted in some way, having these kind of like emotionally labile kinds of experiences, and then engaging in some of these behaviors can really decrease people's sense of self-efficacy and their ability to really be assertive in particular situations. And, you know, again, society and abusers in particular have really undermined the ability for folks to engage in these interpersonally effective behaviors. And then you may also see increased disorganization. So this might look like missing appointments, perhaps giving inconsistent accounts. And I think someone made a really good point earlier about when you have multiple traumatic events and you are recounting the event, it's very easy for events from one experience to kind of bleed over into other experiences. And so from your perspective, it might seem like this person's story is changing, but in fact, it really might be that, you know, there are different ways that they are thinking about their traumas, and traumas really do start to kind of get merged in kind of interesting ways. So I'm going to pause for just a minute. We're running a little bit short on time because I want to be able to do breakout groups. So I'm not going to have you type in the chat here, but I do want you to just be thinking a little bit, and you already gave some great ones in the last chat, but like what kinds of symptoms, presentations, et cetera, have you seen with your clients who may have experienced complex trauma or re-victimization? I'm going to give you about a minute, probably 30 seconds actually. Write this down perhaps, and then we will revisit it when we do question and answer. Okay. So very briefly, I have just a couple more slides and then we're gonna move to breakout groups. I wanted to just touch on this issue of labeling and acknowledgement. So I mentioned this earlier, but we see that about 60% of people, and this varies according to the sample that you're looking at, will report a behaviorally specific event that meets criteria for rape or sexual assault. So they may say, this person inserted their penis in my vagina without my consent, you know, by twisting my arm. They will admit that, but then they will not label what happened to them as rape or sexual assault. And so there are a lot of different reasons why a person may choose to not label it this way. And again, I think that sometimes this can be a little bit confusing because you want to use terminology that is similar across folks. Some of the benefits of not acknowledging might be not thinking of yourself as a victim, right? So not taking on that victim label, and there can be a lot of benefits to that. We do see, for example, lower mental health symptoms, so fewer PTSD and depression symptoms among people who don't label what happened to them as sexual assault or rape. However, unacknowledgement has a lot of drawbacks. So one, we see that there tends to be increased acceptance of rape myths, so kind of general beliefs that survivors are at fault for victimization experiences, and a lot more self-blame in these groups. We also see that they're less likely to seek medical attention. So they may have very similar concerns to people who acknowledge what happened to them to be like rape or sexual assault related to things like HIV, pregnancy, and sexually transmitted infections. But because they don't label their experience that way, they don't realize that they're eligible for services, and they often don't seek services for those kinds of things. And then lastly, they have a higher likelihood of having it happen again. So if you don't label what happened as sexual violence or sexual assault, it's significantly more likely that it will happen again. All this said, I still don't advocate trying to force labels on people. So I would not suggest that you talk with them about it's really important for you to label things in a certain way. I highly recommend talking with people using the language that they use. And if you do have to do some education about, like, you know, you've told me about a lot of different experiences you've had, you know, just so you know, these kinds of experiences do meet these legal definitions that might not be how you feel, but just so that you're not taken aback when people might be talking about this in like court settings or in legal settings, you know, here are some of the labels that the legal system might put on this. That can be really helpful for people. The other piece that I wanted to just briefly touch upon is issues around disclosure and reporting, social reactions, and recovery. So informal disclosure, which means talking to friends, family members, or some other trusted person, is actually quite common. So we see that somewhere between like 60 to 75% of survivors tell someone about what happened. But formal reporting, as I'm sure you all know, is much, much less common. Rape and sexual assault are the single most underreported crimes. And so only about 16% of folks formally report to police. And so I want to talk just a little bit about what might be going on with some of the disclosure and reporting stuff. And so one piece that might be very important for folks in this room to be thinking about is like, what have the reactions to prior disclosures been for people? And so for many folks, they're not positive. And I think that that's really important for you to know, because you might be questioning, like, why is this person having so much difficulty telling their story to me? You know, why is there so much reluctance on their part? Like what is that? And starting off with kind of like, you know, saying, you know, I don't need to hear the details right now, but like, I just want to hear about like, what was your experience like? You know, if you've told someone about this, like, what was that interpersonal experience like? Because it can be really important to know if the person didn't believe them. I had a person recently tell me that, you know, she didn't tell anyone for the longest time. She finally disclosed to her like current partner, and he broke up with her on the spot. Like, it was like, yeah. So reacted in a really, really negative way. When you do have people who maybe didn't have the most positive experiences to their social, to disclosing these kinds of events, it may be really important to work harder to build trust. And this might be especially important for Black, Indigenous, and people of color who are reporting violence to you. Oftentimes they are met with really unsupportive responses, both in, usually by like the social systems and like the systems that we use to kind of address some of these concerns. And so I think it's really important to know, like, if you told the police, like, how did they respond to you? a lot of people tell me stories about kind of feeling re-victimized by police questions. And so that's a whole separate kind of issue, but I think it's a really important thing to think about. And then lastly, I just want to comment on recovery. So disclosure and reporting are really important because they can often help connect people to services. And so folks who don't disclose and don't report may not have the same options of getting connected to services that can really help folks. And this can be especially challenging for bisexual women and Black women. They report greater barriers to getting into services, to disclosing. They have more negative social reactions to their disclosures. And this in turn impacts their trajectories of recovery. And so I think that's important to note. And then lastly, I think, you know, I started off the conversation talking a lot about complex trauma and like early life experiences, but we see even that repeated adult victimization experiences very much undermine survivors' recovery. So I don't want to ever discount the influence that those kinds of experiences can have. So I just wanted to end with a few things that you can think about doing with clients. So one, and I'm guessing many of these things you're already doing, so we can talk about like more specifics if that's helpful in Q&A. But one is really to try to make clients feel as safe and as comfortable as possible. And so really thinking about your space, if there's anything you can do to make your space feel more comfortable or more safe, but then also kind of like, you know, taking the time to really build trust with them so that they feel like you are a safe person to talk to. Empathic listening goes a long way. So really, you know, non-judgmental, you know, really just trying to hear about their experiences, giving them space to tell someone about them and to not be the only person in some cases, like carrying that experience can be really powerful. Trying to ask neutral, non-judgmental questions. And I know this gets hard because you may have like a certain set of questions that you need to ask. And so if you do have to do something like that, what I would recommend is, you know, really trying to preface for them, like I have to ask these questions in a certain way and letting them know why you're asking them in that way and that maybe you don't necessarily agree with that way of asking. So they still see you as a safe person that they can trust. Being patient. So many of you, I think, already kind of noted this, but it can take a while to get someone to like feel safe and comfortable enough to really open up to you. With these long and extensive trauma histories too, it can be really difficult for people to even kind of make sense of it in their own minds, let alone like convey that to you in a succinct way. So patience is critical. And then taking breaks as needed. So sometimes with patients or with clients in your case, you know, you might be used to being able to get through certain interviews in a certain amount of time, and it may take longer with these folks. You may have to schedule multiple times, or you may have to really build in breaks so that they can have a moment to like take a breather and recharge before coming back to it. The very last thing that I wanted to say is to not forget to take care of yourself. So I think I always use the metaphor of like, you know, the flight attendant saying you have to put on your own oxygen mask before you can help other people. And I think that's absolutely true. Vicarious trauma is real. And, you know, hearing different trauma accounts day in and day out can really take a toll on us. So I think it's critical that we figure out ways to take care of ourselves, whether that's forming a support group amongst your peers or, you know, figuring out what strategies really work for you, exercising, meditating, you know, making sure you're sleeping enough, doing the basics is really, really important because you're not going to be able to be there for someone if it's taking a toll on you. Okay, so I'm not going to read through this again, but we're going to come back to this case example now, and we're going to break out into some groups. So I think we're going to do breakout rooms. And Uju would probably have a better sense of how many people are going to be in each one. But what I will ask is that you choose someone when you first get into the group who is going to be responsible for kind of reporting back out. And this doesn't have to be everything that you talked about, but just like picking something that you wouldn't mind sharing with the larger group when you come back. And so what you're going to be doing is looking at that case study that we started with, and then brainstorm in your group about the following questions. So one is, how does what you learned today kind of help you approach this particular case, if this were your case that you were seeing? And then two is, what are some tools you might use with a client who's had multiple trauma experiences or re-victimization to help them feel more comfortable disclosing to you? So Uju, I'm going to let you go ahead and split folks out.
I'm actually going to split everybody into rooms now. Just a reminder, everybody, that the examples are in the Google Drive if you don't recall them. But give me about a minute or two. I'm starting the breakout rooms, but because of how many people we have here today, it does take a bit of time. So in the next 1 to 2 minutes, you will be split up into a variety of different rooms.
How much time, Kate, should we leave for the?
Yeah, let's do 15 minutes.
Okay, we'll see everybody soon. And I see the number of participants in this chat is dwindling, so it is working. Still about 70 people in here, so just give it a couple more seconds and everybody should be placed. I know some people are saying that they might not be in a location where it's safe for them to participate, and so certainly just observe. Right, for those of you still with us, we know, don't worry, you're getting placed. I think there might be a few people on the call. Just make sure that if you see a message that's popping up saying join breakout room, to please go ahead and join that, because we're not going to be doing anything in this one for the next 10 to 12 minutes.
Hi, I'm not sure what breakout room I'm supposed to go to. I had to go into settings to activate my video.
That's okay. Do you mind saying your name for me and then I can help this out?
Jacqueline.
Okay, sure. Give me one quick second.
Thank you.
I'm going to assign you to one right now, okay?
Thanks.
If there's anybody else that's on this call that's having some trouble getting into a breakout room, please let us know.
Yeah.
Hello,
There's
how can I
Peter.
help? How can I help?
Oh, so you pop in when Amy asks for help.
Yes.
Oh, we thought we needed to wait for you.
Oh, no, you don't need to wait. Please go ahead and get started. I'll send a message to everybody to make that clear. So just within yourselves, go ahead and assign somebody to take some notes. You've still got a full 5 minutes left and just kind of get started talking. So do you guys, in terms of like what we're going to be talking about, we're going to be talking about how would you approach the case example where somebody's coming with you with multiple victimizations, where they've relapsed many times, they've suffered a lot of trauma, they now want to re-engage, they've just recently gotten sober again, and what are some tools that you might use when you are building that client relationship and advising them? Thanks all.
Yeah, thank you.
I'm going to call everybody back in from the breakout rooms now. It should take a couple of minutes. All right, we are trickling back in here. Thank you all so much for participating in the breakout rooms. We're really eager to hear some of the things that you discussed. So if there is anybody from any of the breakout rooms who is willing to share for just a minute or so some of the main things that your breakout room discussed, I invite you to send me a quick message in the chat if you were the reporter back, and then I will identify you so you can unmute yourself and give some of your feedback. Great. Jessica Wagner, why don't you go ahead and start for group one?
Hello, everybody. Our group had kind of an interesting mix of professions. What I thought was most interesting and what we all kind of took from this is the different levels of traumatization throughout our different professions. Specifically me, I'm a prosecutor, so I don't have victims coming to court, and they tend to feel like they're not part of the process, especially I have pointed out during COVID times, they feel like they've been kind of abandoned and left without justice. And the difference between that and, you know, some of the people in our group who have contact with them and they have regular contact with their abusers and how that affects them. I think the biggest tool that all of us kind of took from it and what we all kind of mentioned was the ability to recognize things that maybe they don't see. And I know the specific example that we had talked about was, you know, maybe not classifying something as a sexual assault or a rape, I think was the example used. And being able to pinpoint those and speak with them about it in a way that doesn't maybe put a label on it, but still we're able to speak with them about specifics without kind of going around the back door and being able to talk to people without really getting into the nitty-gritty. One of the members of our group specifically mentioned relying on medical records that they read and kind of being able to pull details that aren't in the reports without saying, hey, tell me all about what happened to you at the hospital, which I thought was a great idea.
Yeah, definitely. Thank you for sharing.
Thank you.
I'm going to turn to Juana Torres, if you can present what some of your group spoke about.
Hi, good afternoon. So our group was somewhat interesting and we all kind of have a very similar approach. For myself, I often have to interview children. And so what I took away from the lecture was basically that I have to really work on developing neutral questions, although the lawyer in me always wants the detail. But that's something that I'm always striving to do with my particular clients. My colleagues indicated that they would ask the client what would make them more comfortable. And I found that to be, you know, really the right thing to do, given the fact that overall we are dealing with people that have complex traumas. So to set the pace and the tone, I think that was just spot on. And then lastly, the third colleague indicated, and she was a prosecutor, and she indicated that she oftentimes uses other resources such as victim advocates and just other advocates in general. So that's pretty much what we discussed.
Great, thank you. Really important to make sure the client's leading this, and also I feel like this is one of the main things where we're all getting together with advocates, lawyers, people from all sides of the spectrum, and hopefully we can continue to work in that way, as you mentioned, to help serve survivors. I'd like to turn now to Diana Adams, if you can present from what your group spoke about.
Yes, thank you. So we spoke a little bit about some of the similar kinds of issues of building trust that people have already mentioned. And we also talked about one of the challenges that I see as a custody lawyer in this that we discussed was that if she has a goal of getting custody of her children, that may not be a realistic goal right now. If she's had three supervised visits in 5 years and she's currently homeless and she's had a recent detox, that's really probably not going to happen. And so we want to set her up for success and not for feeling like a failure or feeling rejection or feeling judgment or re-victimization through the court system. And so one way to do that would be, first off, to really build a deep level of trust with her. I spoke about how I sometimes self-identify as a survivor who grew up in poverty, and also share that I've worked with many other people in her situation and that she can feel comfortable sharing anything that's happened, that her responses to the things she's been through are understandable and that I'm not here to judge her. And we talked about some of the ways that we can build trust. And then also being able to talk about how we might want to pick a stepping stone goal and maybe shift a bit from the I want custody to let's see if we can get supervised visitation, not at the social work center, but instead at a trusted friend who, trusted friend's home or a relative who could then also be a positive advocate on speaking on her behalf in court, and then move from that to unsupervised visits, and try to give some potentially attainable goals along the way.
Yes, I'm so glad you got to what I was going to say at the end of this already. Your group is great and you guys are already there. Certainly kind of, your client's choice, what they want to go forward with. But if you can spend that time building the trust, setting realistic goals as a stepping stone, making sure somebody can see the light at the end of the tunnel and why we're talking about that can be so incredibly essential. Including just explaining to somebody, what can happen if they show up in court and say, I think I should have custody, what that reflects to the court in terms of their own understanding of how their children might be impacted with such a quick switch. So really great. Thank you so much. How about Mark Hager? Can you tell us a little bit about what your group spoke about?
Yes, hello, good afternoon. We spoke about similar issues, the first being that we wanted to establish, number one that we brought up was recognizing that there are extensive trauma as well as repeated triggers that might affect our clients. So we started about taking approaches to build trust, which included kind of easing into this a little bit, making sure that the client feels comfortable, especially since we're utilizing more challenging means of communication now than face-to-face or direct office time. So we talked about kind of easing into the conversation and also providing agendas for not only specific court dates and times that we might actually have to do a deeper dive into the history and trauma, but laying out that agenda and saying that, at the beginning of the call, like, this is what we're going to talk about today. And I think it will help prepare the client for those topics that might be more difficult. It lets the client actively participate in the conversation, prepare themselves for where the conversation is going. And I think that also highlights the pathway of the trajectory of the case, in that the expectations might not be realistic from the beginning, and you're moving towards a different type of situation by going piece by piece and step by step. We also talked about making sure that the client has the ability and understanding that we can take frequent breaks and we don't have to get all the information all at once. That's unrealistic on our part in order to do that. So understanding that the collection of the information is going to take multiple times, that it's going to take time and effort on both the part of the advocate, be them an attorney or otherwise, and the client themselves, and empower the client to be able to set the times for those breaks or inform the person that, you know, they need a moment, they need a 5-minute break, or they need to end for the day, and we'll report back at a different time.
Great. I'm so glad that your group all spoke about kind of the realities of COVID now, which we're now very far into, and it's important to take into account. I also really like the recognition that sometimes we have unrealistic expectations and they're being set on us by our systems, right? And the demands that they're giving us. And so sometimes when we're meeting with clients, it's a really quick turnaround where we have to be able to teleport their position, where we have to be able to draft a petition or draft an affidavit for whatever type of case it is, whether it be an immigration filing, a family court hearing, a police report and a criminal complaint that we're assisting them with doing as an advocate. And, you know, taking into account, I think, something that was talked about before by Kate about conflating and the reality that sometimes when there's so much trauma, such a level of violence for such a period of time, even with just one partner, that can be really hard, and acknowledging that if we put those unrealistic demands on our client, we're not going to be able to build the trust we need to actually do a long-term relationship with them. We might scare them from continuing with the case, and we're also just not setting them up for success to achieve their goals. And that's when really strategizing, right? Like, you know, do you draft a family offense petition that has 15 different allegations in it? Or do you draft one that gets to, you know, 3 very specifically and one kind of catch-all that references there might be more out there, is really kind of an important strategy call to do in addition. I apologize, that is me. So thank you so much for sharing. I'm gonna turn this over now to Alexandra Militano to share what their group discussed.
Sure, thanks. So I'm a prosecutor. I came to this discussion with that perspective. I think we spoke a lot about similar things that were similar to Mark Hager's group, in that we discussed, you know, how to make somebody comfortable, how to establish rapport, you know, get people to the place where they're speaking to you in a more trusting and in a more free way, because then you're getting more information, you're better equipped to help that person. And I think what's a useful takeaway from what we've heard today is that, you know, people who have a lot of trauma are not going to necessarily give you the events of their life in a linear way, or in a way where you can fit each event into its own separate little box right at the outset, and that you really have to try as much as you're able, whatever your profession is, to give the person as much time as you can to be able to get to the place where you can address the very serious subjects that they have come to you about in a way where you're benefiting them in the best way. And in my line of work, I speak to a lot of mostly women, but people who are the victim of sexual assault and children. And we are constantly trying to expand the amount of time we build into our cases that enables us to speak with children and victims as much as possible, so that they're not feeling rushed. Because I think somebody mentioned it before, you want people to understand that they're being heard, right? Whatever their age range, right? And I think if you give them time, that enables them to speak to you more freely, to trust you more, to share more with you. And also, if you're not getting the information in a linear way, you begin to understand how they're giving it to you. And then you can sort it into your own, you know, your own sort of mental timeline, and it enables you to use the information in the best way you can and help them in the best way you can.
Definitely. And this concept of kind of being heard and building time for attorney trust that we hear repeated, right? One of the things that we spoke about here is that when people respond poorly, we're a part of the system. We are, by being attorneys in it. We have to recognize that we're coming into the space with that tie to us. Mm-hmm. And so us giving kind of that type of response is so essential, so that they're not being re-victimized through us.
but people who are victimized and who are victimized multiple times and who are horribly victimized respond poorly. I mean, that's the reality of the situation. So, you know, the professional has to understand that and understand like how to contend with it and how to contend with it with each different person, because everybody is going to be different.
Definitely. And to come at it without judgment and with understanding, perhaps, even though it's difficult. I'm going to call on a few extra people. For those I haven't been able to call on from groups that want to share things in the chat, we're going to make the answers accessible to all at the end. But we'll call on perhaps 1 to 2 more people before we move to the big question and answer section. So Liz Brownbrack, can you give us some information about things maybe we haven't covered that your group discussed?
Yeah, absolutely. So one strategy someone suggested was, so the client doesn't have to retell the story, was to partner with some of the other clients' service providers, like having the therapist involved, of course, upon the client's consent, and if the client agrees with that strategy. So that was, I thought, a really good idea, so the client isn't re-victimized just by our questions. And someone else had commented how this fact pattern was so similar to the Lisa Montgomery case. And I don't know if you had heard about that case, but she was recently executed. And one of the ideas is that it's so important to have good expert testimony who can talk about this trauma and to hopefully mitigate the sentences. And then for us in family court, without a lack of resources, it's so hard to find experts that we can work with to put on the stand to explain multiple traumas. So I think those were the main differences that we talked about.
Great, thank you. Yes, the use of experts so important. It's hard for us to do with our limited resources and limited time, but really essential to push for when we need them. I'm going to call on one more group to share, but before I do that, I am going to launch the second CLE poll because I have to at this time. For those who are attorneys and want credit, please respond to the poll that is about to appear on your screen. If you have the Zoom set up as full screen, it might be just hiding behind that. So perhaps see if a different web browser window has opened up. I'm going to leave this up here for a full 1.5 minutes, but while I do that, I am going to call on somebody else to share what their group spoke about. So Jessica Mussel, if you're able to share your group's response.
Yes, I think I don't want to reiterate everything everyone else has already said, but our group focused a lot on making sure that the client understands that there's absolutely no judgment, because we are coming from the system, and to give very intimate details about different types of violence. I think just we all agreed that we all try to reaffirm for the client that we're not here to judge them in any way. We also discussed that we want to make sure that the client knows that they lead the process. This is their case. These are their legal goals. And we don't want them to think that they're doing something because we told them to do it. It's because it's what they want to do. And if that means not including certain acts of violence that have occurred to them in motion papers and complaints and petitions, that we don't have to. One thing we talked about is when a client's memory, like events start to bleed together or not kind of coherent or in a linear time, that we, try to advise the client, okay, let's take some deep breaths. Maybe we should end the meeting here, regroup, set a new date, know that we're there for the client for multiple appointments, multiple meetings, not just you have 1 hour of my time, go. One important thing, one of the Marie in our group, who is a domestic violence victim, indicated that what she identified strongly with in the presentation was the vicarious trauma and how it can be triggering, especially when the client is of the same demographic background as you. So she found it helpful to be a little more cognizant of when vicarious trauma sneaks up on you and when you are being triggered.
Definitely, that's such a good point. We're actually going to have a whole training. I think it's our 7th in the series where we have 2 experts talking to us about our vicarious trauma. And we really urge everyone to attend. I'm just going to give a quick flag that there's about 10 more seconds for the CLE poll if anybody wants to respond to it. And thank you all. We're so grateful that everybody was not only able to attend this, but to really participate and have a fruitful discussion. I'm going to close the CLE poll now and turn this back over to Kate. Thanks.
Wonderful. I am happy. So this is the question and answer portion. I will be putting my slides back up after, just so people can get the information that they need from the last slide there. But right now, I'm here to answer questions. So please feel free to type in the chat or to raise your hand. I'll try to see if I can look through all the pages.
So we did have one question that was sent in earlier. We can start there while people are typing in and raising their hands, which is, so what are some kind of best practices if somebody comes to your office like Antonia and is kind of presenting with multiple layers of victimization and increased trauma? How do we, many people are talking about how we have to be realistic with them about what their possibilities are. How do we kind of explain the process, share bad news, build that attorney trust? What are some best practices that people can use?
Yeah, I think that's a great question. So you've probably heard the term trauma-informed and client-centered a lot, and a lot of the things folks were describing that their group talked about were really client-centered. So it was really thinking about like, how do I make this person feel comfortable, et cetera. And so those are definitely best practices. I think an important thing to think about is respecting folks' autonomy, because yes, they've had like, these really awful things happen in their lives, but they are still like, they are people who want to like reclaim kind of some control and some level of autonomy over things. And so, a lot of what we talked about, like not labeling things for people, really working with them around their labels, meeting them where they are, I think is so critical, and kind of like honoring that, so kind of recognizing that different people are going to be at different stages along the way to the road to recovery, if you will, and really thinking about how you can honor that and meet them where they are. And so many of the suggestions you already raised, going at their pace, like allowing them to like have more control over kind of what the disclosure process looks like. This is so critical. It's really, you're taking somebody who's had a long history of people taking control away from them and really like reinstilling this idea that like they are in control of this process. I think another really critical thing, and I don't know the degree to which folks do this already, but being really clear with clients about when you do have to give bad news, or when there is like a system that doesn't work well for them, calling that out, like naming that for what it is, so that they get that you get it, like that's a way of forming like an attachment with them, showing them that like you really understand their experience of this and their struggles. And so I think the more you can like name those kinds of things and kind of, say, listen, I know this isn't ideal, and really develop empathy around that with them, I think that can really help people feel like, okay, you get it. We're in this together. You're working with me against this system, and you aren't the system, essentially. So I think the more you can do that, the better.
Yeah, I think that's so important. I think something I always, navigate is sometimes it feels awkward, right? To say like that judge was really aggressive to you. They have a bias against you. All of those things, when somebody's calling you and like, this happened to me because of X, and you're like, I don't know if that's true or not. But something that I like to think about is what is the statement that's made if we don't acknowledge that? What is the statement that's made if we're in a courtroom where a judge is screaming at our client? This has happened to me. I had a client that was engaged in sex work and was screaming to her about that, and how that was all he cared about in terms of believing her. And if I walked out of that courtroom and didn't address that, then I'm clearly going to be aligned with what it is that judge is saying, right? With how that opposing counsel is responding, with how law enforcement agencies are responding. And so we do, the effect of not saying something is, I think, what hopefully will push us to say things that we might feel uncomfortable otherwise saying.
Absolutely. Yeah, really well said. I was just asked to put the screen up again, just so that folks can get their CE credits. So I'm just going to share the very last screen, if that's okay, and then we can keep talking as that's up. So,
So as a quick reminder for those who've been here before, those who are joining us for the first time, there is going to be a barcode type image that's going to appear at your screen. This is for us to get a post-session evaluation. We read these, we take them very seriously, we fold them into how we do our future presentations. So please take the time to answer this post-session evaluation for us. We really appreciate it. For those who don't know how to use the barcode, you simply hold your phone camera screen up to it, and it should automatically take you to a link. And if that doesn't work, we will be sending an actual link versus a barcode to you shortly thereafter, after we finish up the CLE. So don't worry, there'll be another opportunity to respond. Another thing, Kate, that had come up in terms of questions is how do you handle, how do you work with somebody where there are issues of credibility, whether it's because they may be conflating instances of abuse, which we've spoken about before, or because they've made reports before, and because of the way that our system works, perhaps those reports weren't believed, and so they're kind of going to be labeled by the system as somebody who has tried this at other times.
I think that's a great question. And in my experience, I'm coming at this from a different perspective where I always believe, you know, the person who's in front of me, and I don't have to be kind of separating out where the truth is, et cetera. I think as much as possible, you know, instilling in them that you believe them, but trying to help educate them around like how prior events may have shaped things so that the system is structured in a way kind of against them, I think can be really helpful. It's really frustrating, I think, from the perspective of the person who's trying to come forward. They've tried to come forward many times before, but for whatever reason have now been labeled as, you know, being someone whose reports can't be trusted. I think I would empathize with that experience and really say, you know, I understand how difficult it is to like trust me right now and to trust the system right now when in the past you've had these really awful experiences. And I know that this is definitely going to be, you know, a hurdle that we will have to overcome. You know, I want you to know that I get it, that I get that this is kind of like what has happened with you. I think the issue of people being, you know, not being seen as credible witnesses by the court, I mean, part of that is really also, you know, someone raised the issue of having expert testimony and having people that you can call upon to like kind of help to explain this. I think a big piece does need to be around kind of like educating the legal system around, you know, like we're doing today, sort of like, what does this look like in real life, and really helping folks in the general community who are going to be serving on juries, and like people who are going to be judges in cases, and folks who are, you know, going to be prosecuting or defending, to really, really understand that our ideas of what like a good victim or a good witness looks like may not really reflect what is happening for people in their lives. And so I think that's just a critical piece to kind of keep in mind and to really empathize with the folks that you're working with around.
Yeah, I couldn't agree more. Educating the system and those engaged in it is so important. One other thing that comes to mind is, you know, something that we're hoping that everybody's getting out of these presentations is, you know, Kate at various points throughout this, and Denise and Uju at the presentations before, they've flagged what some of these behaviors might appear, how somebody might present when things are happening, that is a sign that there's multiple victimizations, that there's re-victimization, that there's complex trauma, that there might be PTSD. And the purpose is not for any of us who are not mental health professionals to then say to the client, like, you might have PTSD, go see somebody. But what it is, it's supposed to be a flag for us, right? Mm-hmm. And so at the outset, if you see somebody who has like a really kind of blunt affect appearing in front of you, or appears, you know, really elevated and angry at moments that for you aren't making sense, that might be a sign to you, like, I need to reach out to resources for this client. This would be a great mm-hmm. moment to further my legal case. I need to make sure that the client also has the support, if they're willing and want to engage in it, to be able to process this with an expert, to have that extra place to be able to kind of cope and address the trauma that they're experiencing, again, by going through the system and have experienced in the past, and to link up with people. And that if those flags are showing that maybe that's when you strategize your case a little bit. You say, do we file now? Do we wait till we have supportive resources? If we file now, what level of specificity, how many, you know, allegations are we going to be including at this exact moment? What is our ask at this exact moment? And talk through that. You know, client strategy is a lot about the lawyer, you know, what we decide to do, but it should be in collaboration with clients, in particular with clients that have had their agency taken away so many times and are coming to us with distrust in the system. Making those decisions without conversation and without kind of like their buy-in to it is going to be super problematic. But fold that into your client strategy when these flags are coming up. I don't know if anybody else has any questions. Please feel free to fold them into the chat. I'm going to give about a minute more to see if anything else comes up. Okay, so thank you so much, Kate, for coming and joining and presenting to everybody over the past 2 hours. This was really an amazing presentation, and honestly, I know I say this every single time, but the fact we have over 100 people here is just like, I'm so incredibly grateful to see how many people are really committed to doing this, because what Kate said before, like educating the system, that is what we are doing right now. And that is what you guys can take from this to pass on to other people, your coworkers, your colleagues, your organizations, educating the courts in the cases that you're on. And so having everybody kind of be really committed to serve survivors of trauma and to continue to enhance our skills. So many people here have been doing this for so long and so well is just an incredible commitment, and we're really grateful to you all. A brief, please do the post-session evaluation. I put this in a chat, but there will be a follow-up email shortly after this training ends that will have the post-session evaluation as link in case the barcode didn't work for you, as well as a CLE evaluation link. You have to do the CLE evaluation in order to get CLE credit. I'm going to put my email one more time in the chat for anybody that had CLE issues throughout. A reminder, I had messaged back to please email me after this so that we can troubleshoot those together. And thank you all for joining us. I don't know if anybody has anything else to say before we close out.
I just wanted to thank everyone for letting me come and speak with you. This has really been an honor, and I'm so happy to hear that there are, you know, people doing this work who are so invested in wanting to do it from a trauma-focused and trauma-informed perspective. So thank you so much.
Fabulous job. Thank you.
Thank you. Have a good weekend, everybody.
Okay, bye-bye.
Thank
Take
you.
care, everyone.
Thank you.
Dr. Walsh, thank you so much.
Oh, you are so welcome. Very nice to speak with you.